A charity which helps people who have ME says it's frustrated and dismayed after they were told by the Health and Social Care Board that specialist treatment for the condition could be combined with proposed services for long COVID.
Well, since its formation in 2011, the charity has been lobbying for specialist ME services here, but they say they haven't had much joy. And this is an issue that we've talked about before. So we're keen to update you here on the programme.
Yep. They're now concerned that the situation could actually be made worse if the two conditions are grouped together for targeted care. Meanwhile, a specialist has warned that attempting to link the two conditions here could swamp the service, with long COVID sufferers and those with ME could miss out.
Well, Joan McParland is a spokesperson for the charity and also a long-term ME sufferer, and Dr. Charles Shepherd is medical advisor to the ME Association. Nice to have you both with us. Joan, if I can start with you, I mean, how concerned are you now that, in your view, rather than things improving, they may get worse?
Well, first of all, Kenneth, thank you for highlighting the ongoing 10-year plight of 7,000 ME patients in Northern Ireland, men, women and children. We did foresee this situation coming with long COVID simply because the majority of us who have been incapacitated for decades, it all started with a viral onset disease, which we never recovered from. But to say that ME is long COVID, it's just not acceptable, because we know what ME is. It's classified by the World Health Organization, whereas the incidence, natural history and etiology of long COVID symptoms is not even known. So in a 10-year campaign and promises after promises, we got the rug pulled out from underneath us 3 weeks ago, when it was suggested that we would be simply put into these fatigue long COVID clinics with no ME experts. So we are absolutely gutted and really disheartened about the situation. And can I just say, no matter where we turn, we hit a brick wall.
So where has this come from? You know, when was this first raised? When did you first hear that this was a possibility?
On the, where's the date? It's about 3 weeks ago. The 24th of February. Up until then, the news we were waiting on was when the second round of interviews would be set up for a new ME clinical lead. The first interviews took place in 2018. There was an ME clinical lead appointed, and I can't find another word, but he was messed about for almost a year until he walked away from the job, and they had to start the whole process again. Interviews were scheduled for October 2020, 2 years later, and those interviews had to be suddenly cancelled because there was a mistake made and somebody thought we were going under rheumatology clinics. It's absolutely just going round and round in circles. So actually at the meeting on the 24th, there was a rheumatologist there, a lovely gentleman, and he said, look, ME's not the place. Rheumatology's not the place for ME. We already have a 6-year waiting list. What on earth would we do with another 7,000 patients piled on it? So now we are really frightened that we're going to be thrown under however many long COVID patients there's going to come out of this pandemic.
Dr. Charles Shepherd, if we could bring you in, how do we compare Northern Ireland to other areas in the UK in terms of providing care for those who have ME?
Well, it's really quite scandalous. In England, we have a system of hospital-based referral services, approximately one service for, I would think, every 2 million people. And so, taking Northern Ireland population of 1.8 million, I think it is, there really should be at least one dedicated service. And I've been involved with Joan over all these years trying to get a service up and running for people in Northern Ireland. And it really is shameful that this has not occurred. As you've indicated, there are probably 7,500 people with this illness in Northern Ireland. 25% of them are severely affected. That means they're housebound, bedbound, certainly at some point in their illness. And there are major problems with primary care doctors making an accurate and early diagnosis, and they just don't have anywhere to refer these patients on to get expert management advice. So that is scandalous. Equally, Long COVID, we don't know how many people have got long COVID at the moment. We're guessing it could be around about 150,000 people. That is it's a tsunami that's arriving of another urgent need. These are people who have got 2 layers of illness that like ME/CFS, it's a post-viral condition, and it's got a layer of symptoms like ME/CFS. But on top of that, the COVID patients have got respiratory symptoms. They're often short of breath. They've got heart problems. They may have liver, kidney, gut problems. So although they do have some ME symptoms with them, and there is quite a lot of overlap between ME and long COVID, they really do need a specialist service that's going to assess them properly, find out what's gone wrong, and give them proper management advice, particularly in the areas of their heart and lung problems that many of them have got.
And do you feel that because obviously we're still getting to grips, as you say, with the extent of long COVID, that there might be that, instant reaction to try and deal with that first, as opposed to the ME?
Because with long COVID, with ME, these are people who've built up over, 10, 20, 30 years. With the long COVID people, and they're still arriving, of course, because most of these people are actually people who've been ill at home. They haven't been in hospital. They're fit young adults in their 20s, 30s and 40s. And we've suddenly got perhaps 150,000 people throughout the UK with a totally new disease, which is really very, very disabling. So I think they are, if you join up the two, and as I say, that there are overlaps here where both conditions can be of help to each other, but if you join up the two, because of this enormous demand that there is going to be for the long COVID, the ME patients are just going to get, I think, put to the bottom of the queue. So they really do need their own specialist service, just as the long COVID people do as well.
Obviously, Dr. Shepherd, you wouldn't necessarily maybe agree with it, but is there a case that has been made where the combining of the services makes either clinical or economic sense?
I think as time goes on and we understand more about long COVID and we can separate out the people who've got a long COVID illness which requires help from specialists in respiratory medicine, cardiovascular medicine and those sort of things, I'm convinced that there is a group of people with long COVID who've actually got basically long COVID ME/CFS, and they could slip into the ME service. But I think the ideal situation is, as we've actually got in Cornwall, because I was doing a programme on this only a few weeks ago down there in Truro, where the long COVID clinic and the ME/CFS clinic are separate, but they are linked. They are sharing, knowledge especially about management of these two conditions, but they are separate.